Welcome, everyone. We'll be starting in just a moment. Welcome to our webinar. We'll begin shortly. Welcome to our webinar. We'll be starting shortly. Welcome to our webinar today, everyone. My name is Heather Zemo. I'm the Education Director at IAHSS. Our webinar today is titled Navigating the 2026 Accreditation 360, the new standard from the Joint Commission. A few housekeeping comments I'd like to share first. Feel free to use the chat feature at the bottom of your screen to introduce yourself. There should be time at the end of the presentation for your questions. Please use the Q&A option at the bottom of your Zoom window to submit your questions. And please hold off towards the end to submit them, just in case the content is covered in the beginning of the presentation. This webinar is being recorded, and it will be available in the IAHSS store along with a PDF of the slides. Now I'd like to introduce our speaker for today, David Thompson. David, I'll go ahead and turn it over to you.
All right. Thank you very much, Heather. Well, good morning, everybody. I hope it's morning still. It's Central Time here for me in San Antonio. Hey, my name is Dave Thompson. I'm a Associate Field Director with the Joint Commission. I've been a surveyor, a full-time life safety code surveyor for almost 5 years now with the Joint Commission. Just a really quick background about myself. I am retired Air Force. Anybody that's out there prior service, hoorah. I am a 30-year vet. I spent enlisted in the Air Force initially as a firefighter, became a fire instructor, and then I guess some folks would say crossed to the dark side and became a medical service corps officer. So I spent my last 20 years as a hospital administrator. But I'm in a new role now with the Joint Commission as an associate field director, work with our two field directors. I'm sure a lot of you folks know them, Tim and Jim, Tim Markajon and Jim Grana, our two field directors in life safety. So today I want to go over, though, I know you really want to hear about the A360 and the changes that we're going to go over, and I'm going to jump into that. And I got a couple updates as well of how we're surveying some of our new process for looking at outlying facilities and outpatient facilities that we're doing as well as part of some CMS restructuring. So I'll go through that as well. So let me jump in here. I'm going to turn my camera off, and I am going to jump into this presentation and get going. So quick disclaimer here about Joint Commission and no recording and such. Again, introduction about myself. See there as a new associate field director. And then really that's a couple things I want to go over today with you. So we're going to cover some leadership. I just went over that real quick as well. So again, don't want to spend a lot of time. We got a new hospice program that we started as well in 25. Those offsites that I wanted to reiterate as well that we're doing as part of your survey process. Go over a quick CMS or DOV surveys that CMS checks up on us. And then really the bulk of what we're really going to talk to today with you is the Accreditation 360, which we flipped a switch on 1 January. So here we go. Again, if you, I'm sure a lot of you folks know, I directly report to Tim now, but Jim also with the Joint Commission, he's been in the role, I think, over a year. Tim has about 13, maybe 15 years, I think, with 15 years with the Joint Commission. He's been there. And again, myself coming up on 5 years with the Joint Commission. So surveying outpatient and hospices. So we have changed a bit of our survey process to accommodate hospice care. So let me go over that one first and start with it. So hospice kind of started in March of 25. I'm doing added a whole new standard for them in the hospice care. We add a complement now for life safety. If you are within the hospital we will add that to the complement. If you're a freestanding hospice, we will send a life safety code surveyor to do any inpatient location. So it's usually just a 1 day that we allocate, but it is a new. Um, we've added it is along with hospital, and we have ambulatory, we have now the offsites, and then we have hospice that we are now serving as life safety code surveyors. And just note as well, it's only for deemed organizations. Outpatient facilities. So this one really started in around July, and this was kind of CMS mandated for us again for deemed hospitals that we look at. It's not DoD or it's not VA hospitals or behavioral at the moment as well. But what this has done is increase the staffing for us. So typically we never really went out to these business occupancies, I guess you'd say the best way of saying them, that we really only looked at freestanding EDs, and we went out to any ambulatory surgical centers that you'd have in your organizations. But now we go out with a complement of the ambulatory clinicians. So that kind of really dictates what sites we'll see. I know some of you have have organizations that have multiple outpatient facilities. So now we are required to go out and look at them as well as life safety. And um, it's basically a sample size. If you have several, we take our lead from the ambulatory surveyor that's going out there and what they have to look at, and kind of how we determine how many days and what sites we have to see is kind of on my next slide here, and we'll go over it. It's more for those areas that you're doing complex medical care, chemotherapy, wound care, some of these examples here, cardiac rehab, intensive compounding for pharmacy areas. And so we look at those areas, and if you're doing uh, deep sedation, anesthesia, those are going to be driving factors for those areas that we need to go and look at. And again, we'll look at your application, we look at your BBI, we look how far they are from your org. There are some, we don't have all the um, business rules totally sorted with this yet. We still are working these, but usually about a 35-mile is kind of our guide. And if we're going to go further, then we really need to see what type of how complex those areas are that we need to send a life safety code surveyor. But good rule of thumb, if how many ambulatory days are allocated for your survey for the ambulatory clinician, that's how many days that will go with the life safety as well. And then here also is just a guideline. I know, I guess just to make a quick distinction that folks are probably asking, like, why am I seeing EC and LS and stuff on this form? Just know that A360, right, is for the hospital program, hospital and behavioral health hospitals that we are now serving to as part of the new A360. Ambulatory sites and business occupancy sites have not crossed over to that yet. So we come out and survey you, we are still going to survey to the ESLS standards that you are all used to. And this is just a building guideline that we use as well to go over those areas to ensure that they're staying compliant. And this is also available to you. It's still in your SPG for you to have and review. We're going to touch into that in just a little bit as well. And then some of the areas that we're going to pay attention to. I know we're not doing full-blown patient care in these areas, but we're going to want to look at obviously your drawings. We're going to look at inspection documentation, do a document review. We'll look above ceiling if there's any barriers, especially if that's up against another hospital occupancy, your statement of condition, and BBI. So kind of a quick overview of what we're looking for there. All right, the next thing I want to cover real quick, I'll give you just an update on our CMS direct observation surveys. Again, if you don't realize or maybe make it a little more clear to you, CMS, Center for Medicare and Medicaid Services, is a driving factor for how a lot of hospitals get paid, right? So They file those claims, and in order for CMS to pay, you have to meet standard. And so CMS looks at us as one of their partners, and you can kind of look at us as almost like a contractor, subcontractor for CMS to make sure that the hospitals stay in compliant, and they rely on us in our survey process to ensure you are staying compliant so that you can get monies for Medicare and Medicaid. So we haven't had a lot of these, the government restructuring and a lot of the Doge stuff that was going on affected us as well. So we didn't have a lot of CMS validation surveyors, and that's just a person from CMS comes out and they actually watch us survey. They're making sure that we're staying compliant. They have their checklist as well to make sure we're meeting certain government criteria to ensure that we meet the standards and we're following code and you're following code. So we haven't had many of these. Here's what we had in 25, and again, I haven't heard anything about 26 yet, but we anticipate that they're going to start happening again. And again, just some of the feedback we got, it's been good. It's been we're following the standards. CMS is pleased with the things that we're doing and making sure that you as an org are staying compliant and following NFPA, following FGI guidelines to ensure that we're taking care of patients and the staff. All right. So with that said, we're going to jump into what I know you really want to talk about, what you really want to dive into. So we're going to talk about Accreditation 360. So I'm sure everybody knows now that we've been prepping this since the summer, but now we are full-fledged into the new way that we're surveying. So I'm going to jump into that real quick and start walking you through it. So why did we do all this? Well, really, this is it right here in a nutshell. We wanted to simplify the accreditation process. And this was, again, a lot of the biggest driver to this was CMS setting up our structure to follow their conditions of participation, COPs. And I'll explain those here as we come up in a couple of slides here. But basically, also want to reiterate, and I'll probably say this more than one time throughout this presentation, is that the survey process does not change for us. It's not changing for you, and it's not changing for our surveyors, for life safety, or our other clinicians as well. What's changing is the standards and where we're going to score things. And you'll see here on this slide, it kind of lays out a bit of that reduction of what we've done and how this benefits you. Because really, it's a streamlined approach to reducing elements of performance, almost by 50% in the hospitals and critical access hospitals. So this is really to reduce the burden on you. When you're looking at SAFER matrix, you're trying to decipher, hey, where was that supposed to score? It falls under this, finding, but it's got 10 EPs attached to it, which makes it confusing. So we hope by doing this, it's going to be providing clearer language, concise language, and really that intent for you is to improve your operations. So that's the intent of going to A360. And so what it really is lining up better as you can see here, the conditions of participation that CMS outlines for us and lining those up to the Joint Commission standards. And this is one example where you have one COP and how we have, it must be 10 different elements of performance that can line up. This is where we want to go with this. One COP lines up to one EP. And so it condenses it. It doesn't mean that those findings or anything that we'd observed there goes away, but it's going to be scored now just under the one EP. And so that is, again, in the effort to streamline it make it less complicated, less burdensome, and easier to follow, so that we can make improvements and improve efficiencies. So this whole A360 was a complete redesign, rewrite for us. And so I highlighted there the physical environment for us, which we're talking about here. But all programs across the board, all chapters were revised. So going through rewriting from, you're probably all familiar with the SAG, the Survey Activity Guide. That's what you had before, and it listed all of our standards and compliance and what was required. Now we have gone to a survey process guide, the SPG. Again, I'm going to jump into that with you, but it was a whole rewrite of chapters and everything for life safety that was scored under LS, life safety, or EC, environment and care, is now rolled into just one chapter. It's the physical environment, so PE. So you're going to be scored, or any observations or anything like that will be in PE. There is one other one, NPGs, and we're going to jump into that too. NPGs, so National Performance Goals. So basically, everything that lined up really in a nice fit, I guess you'd say, for EC findings and LS findings that fell into the PE chapter, those all got realigned, streamlined, and consolidated into PE chapter. The ones that we couldn't consolidate or didn't fit, or needed to be moved, or quite frankly needed to be deleted, which again I'm going to go over at the end of my presentation here and show you those, got lined up under national performance goals. I guess an easy way to explain NPGs, and there are 14 of them, and we'll go through them, but really about 4 only apply in the life safety world. But you could look at NPGs as being more policy based. Those are things that the organization, that you have in policy, whereas things that line up in the PE for us are code based. They really are based off of NFPA, ASHRAE requirements, FGI guidance requirements. So you could look at it in a simplified way, like that, code based versus policy based. So culture of safety, that applies to us when we start talking about workplace violence. Sorry, backward. There's also wave testing, point of care, follow manufacturer recommendations. That's going to apply to us when we start talking about medical equipment, workplace and patient safety, managing security risks like badge access and access to your facility, and locking down areas that are sensitive. So that's going to apply as well in life safety. And then probably the last one here is the imaging, MRI compliance and screening processes. So there are several. Most of them apply to clinical side of the house, but there are, I believe, 4 of them, and I'm going to jump into them a little bit more too, that are going to apply in the life safety world. But most all of these lined up, new standards fall in that PE, or physical environment. All right, the survey process guide. So I mentioned this. Again, you all are very familiar. You should be very familiar with our process, and we want you to. I think all of us, and I know particularly, I know when I survey, I make it very, I want to make it very clear to orgs when we come in, hey, we want to be as transparent, we want to be as collaborative as possible, and no surprises to you. So we walk into your organization and we're there to survey, you know exactly what to expect from us. And I think what we've done here is lined up our survey process guide to do exactly that. The guide that you have is the guide that we use. So that survey process guide, again, is available to you. I'm going to go over all the resources at the end, but these are all available to you right now. You should have them. You can go to our jointcommission.org and get all of these guides, crosswalks, everything. I'm jumping ahead of myself, but I'm going to go over those with you because they're all available to you. As I said, the survey process guide, it replaces the SAG. It is better reflects the SOM, the State Operations Manual, to again line up those COPs to our standards than to our survey process to make that a simplified survey process for you. Again, same thing version you have, we have. So that survey process guide, sections based on the CMS COP structure. Yes, I'm going to give you some examples of those. Again, there's a separate chapter we created new for that national performance goal. That's in there as well. And then we also updated your compliance tools. So all of you are familiar with us using our document review checklist. We've got a new one now. That document review checklist got tweaked just a little bit since there are no environmental care plans and a couple tweaks to safety and security. But that is basically the same document checklist review tool that we've used in the past. We're using the same one, but now it's all lined up with PE standards and a couple MPG. Kitchen tracers, I'm going to jump into that too with you. So again, as I just reiterated, we're going to be following the same process. So two things that we do when we survey is life safety, right? There's the document review that we need to go through and make sure you're compliance with fire suppression systems, fire drills, making sure your generators, emergency power, medical equipment, security, hazmat. We are still looking at all those same things and still going to use these tools, document review, checklist tools, kitchen tracers, um, building guidance tour. We're still going to use those to survey to. And so the document review and building tour, those are the two things that are meat and potatoes, you could say, for life safety, and those are going to stay the same. The next slide gives you kind of an example of how we lined up. It's kind of a little bit the reverse. Here's our standard, the PEO 101 EP1, talking about the physical environment, cleanliness of the environment, how it lines up under the COP. Again, most of all of these COPs, again, most you're used to, going to line up under 42, 41, under the physical environment. And then how are we going to make sure you're staying compliant? Through our observations, right? We're either going to go look at your documentation to see that you're staying compliant by making sure you do the checks, or we're physically going to go out, make sure things are clean, things are no stained ceiling tiles, no holes in floors and walls and stuff like that. The next slide talks a little bit more again about how we line up our standards and how we're simplifying our standards to go from our standard lines up under the COP and how that lines up with what CMS is laid out for a simplified process. And then how are we going to make sure that you're staying compliant, whether through our interviews, whether we're going out and physically putting eyes on target and making sure those things are done, or looking at your documentation. As I kind of alluded to earlier, all those compliance tools, they're all in the SPG as well. I would say there are, we had our conference last week. There were a few things that came out of that. So there's a couple tweaks that were made to the survey process guide, which you'll see reflected. But those compliance tools, they're available. They're there for you. As I mentioned, the fire drill matrix, kitchen tracer, document review checklist, KTAG tools, they are all there for your availability. So that again, in all transparency, when we come out to survey, there should be no surprises for you. Really, we want this to be, I guess, for lack of a word, you could say an open book test for you. Okay. I think this is my last example. So again, taking our checklists that are available to you, they're all in the survey process guide. You can print them out, use them. These are what you can expect to see from us as well. When we come out and survey, we're going to bring our checklists and we're going to run through our survey process just like we did in the past. So nothing changes on survey process. just the way that we're going to score things under new standards now in that simplified approach. All right, let's jump into the physical environment chapter. Let's go over this real quick, and I'll show you how these line up um, under the new standards. So first off, this is a really good slide. I mean, I've saved this one to my phone when this first came out. So I'm like, this is really in a nutshell the 8 different chapters that we are serving into. And so when you go to PEO 101, that is basically all of the making sure that the hospital's cleanliness and safe condition. We're going to look at um, making sure that things are got filtration, all those things that make sure that we have a safe environment to work out of. Hazmat just gets moved to PEO 20101. Again, making sure that you have you've done DOT training certificates, you've got hazmat processes, your eyewash stations. We're going to be looking at those things under PO 201. Compliance with life safety. Most all of the LS have rolled up under the PE 030101. So anything that was an LS standard is now going to be scored as a PE 030101. Life safety. ILSMs didn't change. There's one little tweak, I think, to PE2 that can be scored under 030101 about your alarms being out for more than 10 hours. But everything stays the same in the ILSMs. The 15 that are listed that we had before stay the same. Building safety and facility management, PE 040101. A lot of your document review is going to be done here. The document review checklists, kitchen tracers checklists are going to be following PEO 40101. Utility systems. This is where we're going to be looking at a lot of your medical equipment and testing schedules. We're going to make sure that that's going to fall under the PEO 40101. Generator checks, those fall in there as well. Water management just gets a new PE as well. It gets its own PEO 40115. I think there's only 5 EPs that are scored under that. It's kind of small, but it's got it separate. And then the last one is the imaging safety. So PEO 50101, MRI, screening process, like I mentioned. Sometimes we ask for your physicist report. Make sure you're doing special training to make sure staff know not to bring metal and such into those areas. So those are our PE chapters. And this is how they line up. I kind of gave you a heads up on this, but you can see all these EC standards that were scored before are now going to roll up into either these one of the 6 PE standards that these will line up under, and then one of the 4 MPGs. And those are the 4 really MPGs that apply to us. I'll jump into that one just in a second. Again, another great slide to have as a reference as well. And then here are the LS. So all the LS findings roll up now into just these 3 PE findings. Most of them under 30101, PE 030201 are just the ILSMs. And then 040101 really gets into like critical pressures, pressure relationships. We'll score under there. And then I was alluding to as well, these are the new MPGs that really apply to life safety. So workplace violence and doing your workplace violence training, making sure you're doing your workplace, your risk assessment and such. That's going to fall under MPG 020401. Security risks, again, protecting sensitive areas, making sure you have lockdown, making sure you're securing the facility, panic hardware, those things under MPG 110101. Utility systems, again, this one, I guess some good examples would be like pharmacy equipment, making sure it's on backup power, making sure pharmacy medications that are in fridges and freezers, are plugged into backup power and have sensing systems on them. And then imaging safety, again, MPG 130301. Those areas that would apply not just to MRI, I keep saying that, but nuke med, oncology areas that are used in imagery, we want to follow MPG guidance. Okay, what does this mean for the surveyor and what's it mean to you? Really, again, this is what our goal is for you, that we reduce the number of EPs to choose from. It makes it easier to follow. It makes it more consistent for us, for you, and easier to score, if you have findings, right? Okay, so you may not have any because you're following all of them. And I hope you'd be my first survey if I never did, but I'm looking for that. But again, that's not the goal, even surveying, right? It's just we're out there and you're out there to make sure we're reducing risk, right? All these standards, all of these COPs, all of the things in our world in life safety, they are focused on making sure no harm happens or no further harm happens to a patient or staff member, right? I know that's what all of us, our driving goal is. And that's how we're trying to line up our survey process so that we're lining that up and to make it easy for you and easier to follow and to stay compliant. Okay, I'm going to sip a quick water real quick here. I went up to Chicago, and every time I come back from Chicago, I seem to get some kind of bug. All right. All right, the next thing I want to cover, we're going to go over, we kind of compiled a list for you of some common findings, the top findings actually, that were scored under the old standards, ECLS, and give you the new standards. So I'm just going to go through these real quick. Again, at the end here, I'm going to give you resources that you have this information. You have crosswalks and you have disposition guides that, again, if you need to, hey, I know everybody still knows the old ones, and if you don't know where that goes for the new one, you can use those as cross-reference and such, so that you can set up your own kind of checklist and such. So, when we were to score safe spaces and interior spaces suitable, that was ECO 20601 EP1, probably the most common finding that we would see. Where's that going to score now? Well, it's going to score under PEO 101 or 1 EP1. And so the way it's set up, just as it is in that disposition guide and crosswalk, this is all laid out for you. That's where we got all of our information as well. And that's how we made all of our new checklists. So it gives you some examples of what we would see, right? Wall damage, pull cords, unscrew sharps and such. Just some examples. The same thing with ECO 20501 EP9. This had to do with a lot of labeling for your breakers and something not labeled red for the fire alarm control panel or labeled incorrectly. Where is that going to score now? PEO 40101 EP1. So again, makes it more simplified. And we don't have separate ones for different areas. ECO 20601 EP20. Again, another environmental thing and cleanliness. We see this a lot in the orgs as well. And again, if you start following us, where is that going to score? As I mentioned before, anything that's going to deal with cleanliness and such is PEO 10101, EP3. Again, gives you some examples of what we find. ECO 20505 EP6. See this a lot as well, blocking panels, equipment blocking things. J-box is not covered with whether it's a fire alarm panel or whether it's high voltage. So again, where's that going to score? PEO 40101 EP2. Another example, here's an LS finding, LSO 20135 EP14, block fire extinguishers, sealing membranes that have penetrations going through them that are sprinkled. Where's that going to score now? PEO 30101 EP3. Another example, ECO 20601 EP26. See this, rips, tears, and things, degradation, On equipment, where are we going to score this now? This will be scored under PE 04, 01, 01, EP 1 or 2. If it uses those options, it's EP 2. Another finding here about eyewash stations, ECO 20201 EP5. Where is that going to be scored now? This one will be scored under PE 020101 EP4. Another LS finding, LSO 201 35 EP4. This one, again, we see a lot. We look above ceiling. I know you guys know that. But when we find stuff that the sprinkler lines being used to support other cables, HVAC lines, where is that going to be scored now? As I mentioned before, everything that's LS is going to be in that PE 030101 or PE 030201, or it's going to be scored under the PE 040101. Fire barriers, again, fire barriers and smoke barriers, they are definitely areas that we're going to look in your hospital, whether it's in corridors, whether they're in patient rooms. But those separations are very important in our world to make sure that your patients and staff have the ability to defend in place. So we are very thorough about checking your barriers. Where's this going to be scored now? PE 030101 EP3. Again, same thing applies when we're looking at these barriers. Again, no scab patches on fire barriers or smoke barriers. Those are not the proper way to seal them as well. ECO 20501 EP16, a non-critical ventilation pressure relationship. So we're looking at your pharmacies, labs, medication rooms. If you have clean utility rooms with medical equipment being stored in there, clean linen rooms. We're going to look for these pressure checks. What's that going to score now? PE 04, 01, EP3. The same is going to be scored also for critical. I think the slide's not correct in here, and I will get to that. But critical relationships as well are going to be scored. Critical spaces will be scored also at PE 04, 01, EP3. Your ORs, SPD. Here's another example, LSO 20110 EP11, fire doors not latching, not closing properly, wedged open. Where is that going to be scored? PE 030101 EP3. Another example, discussion plates, sprinkler heads, dusty, dirty, debris, degradation. Where is that going to be scored now? It's going to be scored under PE 030101 EP3. Again, another sealing membrane integrity. This is if it's sprinkled and has a smoke detector. LSO 201 34 EP9 will now be scored at PE 030101 EP3. As I mentioned before, this is the critical ventilation. Just don't look at that. All right. It's ECO 20501 EP15 will also be scored as with critical and non-critical PE 040101 EP3. Cylinder handling policy, ECO 20501 EP12 on secure cylinders, improper label of cylinders, mix and matching them, clean or full with empty. Where are we going to score that? PE 040101 EP1. Yeah, okay. That's my last example. So I know I went through those quickly. I mean, these are going to be available as well to you but we did this to start even with our own surveyors. So we went through this. We made up a top 25 most commonly cited findings for our own surveyors so that they could be better prepared to start surveying and know those common ones to help them get started and such until everybody kind of learns the new codes. But as you're seeing, there aren't a lot of codes that you got to remember. Not a lot of not codes, but not a lot of standards that you really need to line up in the different EPs. And again, I believe we even consolidated down under those standards. So PE, there's only like 4 or 5 different parent. You have the standard, and then you have the child, conditions of participation, and I believe there's only 5 under each one of those as well. So again, it's trying to simplify it for you. Okay, so I told you there were some discontinued. I just wanted to highlight these real quick with you so that the ones that really stand out. The most obvious is the environment of care plans. They are no longer scorable. That doesn't mean that you have to stop using them. It doesn't mean that, we'd ask you to, dissolve your environment of care committees and things like that. What we do kind of suggest to you is that if those processes are working for you and they help you stay compliant, we'd encourage you to just keep using them. So that's kind of our guidance to you about the environment of care plans. They're just under the new standard here are not required to be surveyed to. I think that's all 6 of them in there. One of the other things that has gone away are fire drill critiques. So fire drill critiques are no longer being evaluated as well. Not that they're a bad thing, not that you should stop doing critiques, because they absolutely, as a prior firefighter, very important that folks take fire drills seriously and know what to do. So again, encourage you to keep doing them, but they're no longer surveyed. Safety and security incidents are also not being tracked. Not tracked, but not have to be surveyed to. Again, same guidance to you. Security, I think we all know in this day and age and kind of the crazy world we're in sometimes, security is absolutely imperative in hospitals, making sure we're doing our part to keep our patients and staff safe. And then last couple here, that another one about the EOC review of the management plans. Okay, don't have to do that. That's not required anymore. And these last two most all those are EC. I think there's 33 if you add them up. Only really 3 of them apply to LS. And those first couple there are talking about you're probably used to us coming in EC1 or EP1 when we start talking LSO 101, EP1 and 2. Those both go away here as well. So we don't have to assess individual compliance with life safety. We will still use our checklist to make sure that facility managers, directors have competencies, just like we do with clinicians, that, if the org says you're required to have some years of experience, you need to have a degree, you need to have a certification, we are still going to check for that for compliance. And you also do not have to do a building assessment. Again, you do not have to show us one. This was before most folks did EOC rounds or they did a full out annual assessment. Again, not required, but again, that's usually covered under FGI guidance that this requirement's done. So it was not required to be here. Okay, we get through this last bit. I think we're just about through with the presentation. So those were some examples of this discontinued. So some resources here for you. I was mentioned to these before. These publications and everything that we have is available to you through our jointcommission.org. You can go out there right now, get these documents. They're available to you. I know you probably have your account reps that work with us as well and get your copies. But we just absolutely want to make sure that you're aware of these, that you have them. Give some examples, some more. So here's a disposition report. So disposition report's a really nice report to use when you know the old standard. So you can go like, well, hey, I remember where, ECO2, O2, whether you use 01, EP19, I knew where that scored. Where's it score now? And so it will show you where it got moved, or it'll say in the disposition it either got deleted. It'll give you that information too. And then it'll give you the new standard that we're following now. So it's a really nice tool. And here's just more examples of it. It's a pretty long document. It's everything, right? I know you're probably just wanting to know the PE and MPGs that apply for life safety, but the whole Joint Commission has lined up on as all their standards now listed in this disposition report. And so here's where we're going. Crosswalks are out there and available to you as well. So everything, again, lining up under COPs, that's been restructured. But again, we probably can't reiterate enough to you that survey process doesn't change. Just the way that we are lining up the new standards to follow those COPs and simplify this process is the goal of what we want to do for you. Again, just another example where we take a COP, how it lines up, it maps to the old, this is what we used to have, where it was lined up to the new. So again, to make this a simplified process. Okay. I think I got through that pretty, all right. I still got a little bit of time left, right? So that was everything I have in my presentation. And I do have some, I think we've got about 15 minutes to go through any questions that you have. So let me get my.
Thanks, David. That was a lot of great information. Yeah, I do see in the Q&A, if you want to open that up, there are a few questions that came in for you.
Okay. If I can, I'm not really sure I see that. Do you
Okay.
mind giving it to me? And maybe I can, I'll just address.
So this first question came in kind of in the beginning of the presentation, so I'm not sure if you covered it, but someone asked, what happens when a COP applies to multiple COPs?
When a COP applies to multiple. Yeah, that's, there are a few places. There are a few places. We went through a lot of those. Well, we went through all of them actually, and there are just a very few handfuls of places that there's one or two options, and I think whether it was, I'm trying to think, document review, there was options whether it would be EP1 or would it be EP3. I know we went through it and we streamlined that, and I believe when we came up with it, we gave our guidance to which EP it should be scored under. So if there's questions about it and it comes up, we also, I wanted to mention this and throw out to you. I think all you folks are familiar with our SIG group, right? Standards Interpretation Group. They've been a big lift factor as well in our transition, and they redid what we have a database. Again, probably familiar with our site that a lot of our surveyors use, and you can punch in the standards or you punch in keywords, and it will direct you toward, hey, what's the standard? So we've tried to narrow that down as much as we can. And the few outliers that do come up, they should be one-offs that you're not sure which EP to put it under. We would definitely work that with you, or we would work it through SIG as well, if that's not clear, to make sure we get you the right EP.
Okay, next question. Where does security get scored? What types of security are assessed? Example, physical security design, CPTED, electronic security, violence prevention, active shooter response.
Yes, that's a great question. Most of the security stuff is now under MPG because security is a lot of that's policy driven. All right, what's the org's policy for their security implementation? So MPG 02, 04, 01, I think I got that right, is where that's going to be scored, and then workplace violence is within that standard, doing your security risk assessment, and then anything that deals with security, access, sensitive areas, lockdown procedures, those things. is also under the MPG, and it's the I think it's the 110101 that's scored for those incidents, or for those areas.
Okay, we have one more question I will go ahead and read, but if anyone has any additional questions, please feel free to type it in the Q&A box at the bottom of the screen. Okay, the last question that I have right now that's in our queue. It seems you cleaned up the code, but hospitals still have to meet the same requirements. And those requirements are just in the SPG, right? So the code is cleaner, but everyone still does the same thing?
Cleaner, but doing the same thing. I think I'm following your question. None of the codes change, right? None of the standards change. All again, along with the survey process, we're still following, for the most part, for a lot of our guidance. It's NFPA 101, it's NFPA 99, it's ASHRAE 170. That are the guidelines that we are following. And the COPs, again, don't eliminate any of those. They're just streamlining it so that there aren't so many different elements of performance to choose from. Does this have to be scored at EP1? Is it EP3? Is it EP10? We've tried to narrow that down so that the standard to the COP to our to RPE or MPG requirement meets the intent of of the standard and the COP.
Okay, the question I had read was from Stephen, and he actually just replied saying thanks that it answered it. So we're good there. We have one more question that came in. Where can we find MPG 11-101 or 02-04, as you mentioned?
Where can you find it?
Where can you find it?
Yeah, I'll show you all tour. It's in the MPG, right? So that I'm sorry, SPG. It's in the SPG. I'm getting all my acronyms. So in the survey process guide, which you all have available, and you can go right out to the joint org, right, or to the Joint Commission right now, jointcommission.org. All those documents are there. That's where they're all listed in full, and then they're in chapters. So there's a whole chapter dedicated to the to MPGs. We outline a few of those. You'll see from us on some of your document review checklist tools. Security is in there under the MPG. You'll see them, but really all of these standards are in the survey process guide.
Okay. We have another question. Does access to the healthcare facility get tested? IG required check-ins versus not check-in?
Well, this is probably one of those areas where we'd ask you, what is your process or a policy for check-in? What's your requirement for security screening? A lot of orgs are going to things, especially larger hospitals, are putting in complete metal detection systems. They have a lot of times the first person you greet is a security person who either wants to check bags or making sure that you are checking in at the front desk, and have lockdown procedures that you really can't get past the lobby without being escorted, right? So we would ask you what your policy is, and then as with any survey process, we would survey to what you say you're doing, right? If you say yes, this is what we do, and we lock down all access to the hallways and such beyond the lobby, and say we didn't find them locked down, then we'd probably say you're not following your policy. Does that answer your question?
Okay, one more question just popped up. Is there a checklist that security departments can use to ensure the org is meeting all the Joint Commission and CMS standards?
A security document.
A checklist. That's what there is. There a
Oh,
checklist?
the one checklist.
that the security departments can use?
So, for us, and I know I'm talking to a heavily armed security group here with security questions. It's awesome. Um, uh, I would say, other than, we have a few that we go through our document review, right? Those are listed about making sure we hit key things for your security. This is probably one of those areas where I would say your environmental care plans probably lays out more so than your security, what you're doing to make sure you're keeping patients and staff safe. That we have a direct checklist and such, not that I'm aware of, but I'm going to check. So let me take that one back. Um, and see if there's something maybe not that I'm aware of, but a security checklist you're asking for. So I will take that back and see what I can find out. Okay.
Okay, one more question. Did I correctly see that reporting of workplace violence events is discontinued? If so, what was the reasoning behind that decision?
Well, I believe workplace violence is still in there. I don't think that went away. That gets scored. Workplace violence training. I'm pretty sure NPG 020401 is still going to require workplace violence training. I know we ask staff members that they know their response if they have a disgruntled patient or family member. So I do not believe that that one is going away.
Okay, well, that is all the questions that have come in. I just put your email contact in the chat for everyone if they need to reach out or follow up for this. So I think at this point, we're just about at time. So I just want to say thank you, David. And I think that concludes our webinar for today. Thank you, everyone who joined us. And as I had mentioned before, this is being recorded. You can find it in the IAHSF store in the days to come, along with a PDF of the slides. So thank you, everyone, and have a wonderful
Can I,
rest of the day.
can I just leave one parting comment? I mean, again, I really appreciate the opportunity. I don't know if you guys know, I'm only 3 months into my job, but so you didn't beat me up too bad on these questions. But I just always want to share with the orgs and share with you folks that hey, working in healthcare, it's a special place to work, right? And I think most of us who work in healthcare know that you don't stick around healthcare long if you're not really dedicated to serving others. So I just want to say that to you. I know whether in your security realm or a safety realm, it's super important. And I just want to thank all of you for what you do to take care of patients and staff because I know um, serving others is really at the root of healthcare and what we do. And again, I want to say God bless you for what you do, and really thank you for allowing me the opportunity to talk to you all today.
Thanks, David. Have a good one, everyone.
All right, thank you.